Good evening, everyone. Welcome to the Ocean Rock Stars podcast. Today we have Shannon Dean, who's an experienced school counselor, student advocate, and empathy enthusiast, with a demonstrated history of working in secondary education as well as the nonprofit sector. You grew up in Reno, Nevada, but then you moved down to California, and you have your bachelor's in is it business management from the University of Nevada. You continued your education with a master's degree, and you've obtained your master's degree in school counseling and PPS credential from Concordia University in Irvine. You currently reside here in lovely Orange County, and you actually work as a school counselor with the Irvine Unified School District.
That's right.
So that's, very nice background and experience. We actually at Ocean Rock, have an adolescent track as well. And so I think learning a little bit more from you as far as dealing with adolescents, working with families. Overall, today we really want to focus on mental health, substance abuse issues, but focusing more on that adolescent 13 to 17, 18-year-old age group. And, I think the earlier we can start having these conversations, both with the students and also with the families, the more they can learn and the more we can kind of prevent some of the bigger issues that could come along down the road. So really looking forward to hearing from you and wishing you, just really welcoming you to the podcast.
Awesome. Yeah, I'm excited to be here and to be able to talk about that more. I love what you said about early intervention because I feel like that is a huge aspect of what can make or break the success of helping a student.
Right.
And I see that, daily almost when we're able to have an early enough intervention to talk to the student about what's going on and get to the root of the issue, we're that much closer to being able to help them. So
right. So let's start there. Early intervention. I mean, this is, how do you define that?
Well, that's a good question. I think it could be as early as elementary school for some kids. Okay. I think that it totally depends on the student. So I guess an easy example would be an early intervention is as soon as some sort of issue or struggle is recognized, someone's there to intervene and support.
Got it.
So I guess it could be a minimal issue, maybe a behavioral issue, or it could be a more significant issue like a substance abuse issue.
Right. So, I mean, earlier on, sometimes it might not be substance or it might not be something that is as severe. So a lot of people think, okay, well, this is not a big deal. But what would be an example where maybe a behavioral issue or something that you notice in that elementary or early adolescent period where you think this could be the precursor to further issues down the road?
I think there are a few things. I think one of the biggest indicators is a difference in behavior. So maybe withdrawing from friends or different work habits, different levels of irritability at home, different willingness to engage in their family conversations, dinner, anything like that.
Okay.
Usually we want to be able to identify some sort of difference in their regular patterns to be able to say, okay, they're doing this and it's not exactly how they used to feel or how they used to be or how we used to perceive them, like something changed and we're concerned. That's usually when the parents are reaching out for help. Okay.
Yeah. And I see that. But you guys notice at school and some things that would rise to the level of bringing it to the parents' attention.
Yeah. One of the biggest indicators that we look at is just grades.
Okay.
And not so much because a low grade is bad, but because you can track patterns easily that way.
Okay.
So I think that that's one huge difference about working in mental health treatment or substance abuse for adolescents is we have this map of data we can use and say, okay, this was their pattern previously, and this is the pattern now.
Right.
So that's usually our first indicator, or one of the best is peers talking. So sometimes a peer will notice someone else is struggling and they'll say something, and that's the best early intervention we can have, because usually the friends will notice the difference before a teacher or a counselor will. But sometimes we can notice too. So the things that we might notice are if we're regularly checking in with a student and they're disengaged, or we notice a lack of motivation, or sometimes just a different attitude.
Okay. Yeah, no, those are all great signs, and it's either something that the parents, the parents or their peers or the teachers noticed.
Yeah.
And it's between all those where you say, okay, now that we see a pattern, right? It's maybe one thing here or one thing there, that's fine, but now you see a pattern in different settings, and now it's really something to really take that next step.
Yeah.
Okay.
And one of the biggest parts of that is communicating with the student themselves, because a lot of the times sometimes the parent will have already tried to approach the student, and if the student is resistant, a counselor is there to almost battle that resistance with acceptance.
Right.
Like, okay, we're not getting anywhere with the resistance, so let's try to lean into this. Okay, you're frustrated. What's going on?
Right.
Kind of a thing, because otherwise we just don't make progress.
Right. And so kind of now taking it to that next step where we've identified an issue.
Yeah.
Right. You as the school counselor, where do you kind of get involved in, and kind of what's that next step where, in that early intervention process?
Yeah, the school counselor can get involved when a variety of things happen. One, the parents feel like the student needs extra support and doesn't know exactly where to turn next. Or two, the school counselor feels like the student is not receiving the support that they need. So usually if it's a situation where maybe we just need more information from the student, the school counselor will connect with them. Or sometimes the parent says, here's what I believe is going on, and we're there to collect more information and then either refer to outside agencies or continue checking in with the student. But the school counselor has a unique perspective because they're able to view kind of the holistic picture of, like, we can piece together by collaborating with parents.
Right.
We can get some of the social cues from information about what's going on with classmates, and then we can also look at academics. Right. Which is nice to be able to. So it's
kind of a hybrid role of counselor and interventionist, right? Where
absolutely.
You're getting involved at that early period, and it's like, okay, I have the family, I have the student, I have the school setting. Yeah. Really, you're in the best situational, point where you can help at least try to navigate that student and the family to the right place.
Yeah, and that's part of the reason why I got involved in this career in the first place, was because I felt passionate that was important. I think it's a unique perspective because a lot of people, they're able to view what's going on at home or what's going on at school, but not so much the combination of both, and be from a non-biased perspective where it's like, I'm not there for discipline. I am not there to get you in trouble. I'm here to be your advocate and support you. So
you're not the bad guy. You're not
exactly.
The bad guy.
Yeah, which
and you
is
have
nice
that
for me.
You have that kind of independent role.
Yeah.
Where you can build you can build that trust and kind of get through some of those early layers of resistance.
Exactly.
Now, have you found that so they share things with you that maybe they didn't share with their teachers or their peers or their parents, and then how do you work with the student directly? And just in terms of confidentiality, but also in terms of just helping them get to where they need to be? Yeah,
good question. So the school counselor is a mandated reporter, which is sort of a double-edged sword. So in some ways that's great, because if the student is a threat to harm themselves or someone else, we do have the legal requirement to report it. We also have confidentiality with that exception. Okay. So as long as someone is not a threat to themselves or others, no one's at risk of being hurt, there's complete confidentiality.
That's great.
And so we always make an effort to state that to the student, like, this is confidential. I don't have to go call your mom and say, hey, Timmy said that this and this is a problem for him at school. I can
it's only if they give you permission, then that's okay, right?
Yeah. I'm just here to be a friend and figure out how to navigate it with them, which is cool.
No, that's really cool. So they kind of look at you almost as a peer, but it is that you are somebody who is within the system and you're there to help, but at the same time you're independent of all that.
Right.
As well, right?
We want to build that relationship while also letting them know we have the ability to connect them to other resources and to help them navigate those difficult conversations and challenges that they encounter.
Okay. So then now let's talk about, okay, you've built some rapport, you've worked with them, you maybe worked with the family, and sometimes maybe that's all that's needed, right?
Right.
But let's just say that now there's more. You need to bring in more help, right?
Yeah.
Whether that's an outside agency or a treatment center or a private therapist, whatever the situation is. What's that next step look like as far as who do you guys usually work with? How do you work with the families in navigating that process?
Yeah, that depends greatly on what the services they need.
Okay.
So if we think they just need additional therapy, which is usually a good first step,
Right.
We partner with an agency that serves as kind of like a concierge service that connects families with providers based on their insurance.
Okay.
So we work with them to connect them to a therapist. If they're in need of more help than just a therapist, I mean, sometimes we'll have students that we need to put on a hold and make sure that they're transported to a hospital. And sometimes it's less than that. So we also have mental health specialists at the high school who can check in with them regularly. But we kind of assess the level of care needed and go from there.
Right.
Because of my own background, I end up working with a lot of the students with substance abuse difficulties or with maybe a need for a residential treatment for mental health.
Okay.
But I think that just varies based on the school too.
Yeah, I mean, it seems very case by case, right?
Absolutely.
So it's, depending on that child's situation, how severe it is, that's where you guys do the kind of level of care assessment and figure out, what do they really need? Private individual therapy? Do they need an outpatient situation? Is it a residential situation? And then based on that, then you make the proper referrals.
Right. And sometimes we recommend, and this depends on the community, but there are some communities where it's more common to have referrals to an outside agency.
Right.
And there are some communities where we have to promote education more and say, okay, this is what this level of care would mean. Here's what a residential, treatment center would be like for you. And here's what that means. Because some of these families, they've never heard those terms before.
Yeah, I mean, if you don't know, you don't know.
Exactly.
Right? And people go, and that's part of why we do this, is because we want to be a good resource, having people who have expertise and experience come and share, because we know a lot of people are looking on Google, online, on Instagram, on different social media, trying to find information. And then the more you look online, the more different information there is. Sometimes it's misinformation, sometimes it's conflicting information. So we really want to be kind of this resource and this place where people can come and get the education that they need. So, so it seems like you do the same thing within the school system.
Yeah, which I think is important because a lot of it is just about meeting the families where they're at. So seeing what they need to know, helping bridge the gap, and then going from there.
There you go. Okay. You mentioned not only educating them, but I feel that that's a good segue into another topic that I wanted to discuss, this stigma around mental health, addiction. Obviously, it's there for adults, but also for adolescents. And by stigma, I mean that there's a lot of families and individuals, and even probably the students themselves, who just don't think that it applies to them. I don't have an issue, or I don't have, and no one wants to be labeled, right? No one wants to be diagnosed or labeled as something. And there's a lot of misdiagnosis. I mean, a lot of people go online and, you have this, or you have that, or you're this. Well, you can't just get diagnosed like that, right? You have to see a professional. You have to get assessed. Maybe it is that, maybe it isn't. But there's all this stigma around it, and it's just a lot of misinformation about why is somebody dealing with that, right?
Yeah.
Oh, they have a mental health problem because, of this or that, or maybe their addiction because it's their willpower, or it's almost like they're choosing to have these problems,
right?
And that all they have to do is just really, choose not to. And I think choice and willpower is part of the recovery process and part of the process of being healthy, because you have to put in that effort.
Absolutely.
But also it's a disease, and it's been identified, as a disease, both mental health and addiction. And so there's a medical component, there's a clinical component. And I think a lot of people don't know that. And they also might not know that insurance covers treatment, and they think that they have to just pay out of their pocket. And so the good news is that I think today, more so than ever, there is more information, there's more access to information and more access to care. But the irony, at least based on the research we've done, is that although this access is present, people don't know about it, and the utilization of these services is still far less than what it should be.
Right.
And so how are some ways that you, I think through this show and just the way you do it yourself, raise awareness and remove some of that stigma?
Yeah, that's a huge part of the job of a school counselor too, is to try to promote education of mental health awareness. And we do regular events at the school where we're trying to bring awareness to these topics. So sometimes we're bringing in speakers from UCI, and sometimes we're bringing in, known psychiatrists. And I think it's also just a matter of when we're meeting with students to talk about it.
Got it.
And so we try to make it almost like part of the culture to understand, here's, where you go for support. Here's like how this school supports your mental health. And I know that that's part of a school counselor initiative nationwide, is to just incorporate mental health awareness into the school's culture so that it can be more widely accepted. I definitely think we all know it has improved.
Right.
But yeah, I didn't know that you can use your insurance and go to treatment when I was a student in high school.
Right.
So I think that that's a great point, because a lot of people, they just don't know. And you can have more awareness and more acceptance without knowledge of how to act on it.
Right.
So I think that that's a huge component, is not just educating people about, here's what we experience, and this is what depression or substance abuse or whatever the case may be looks like. It's also about, okay, what do you do?
Right.
Who do you call?
Yeah. What exactly? Who do you call? What do you do? What's the next step? A lot of people are lost in that, right?
Yeah.
And, you mentioned mental health. We mentioned addiction, but what are the things that you've noticed? And I think COVID and kind of post-COVID and post-pandemic really changed things. At least during that time, it was because everyone was isolated and a lot of things were created. But although we've moved more towards normalcy, there's still kind of some of the collateral damage that's come around that.
Right.
And I guess what I'm curious about is this day and age. So today, right? Today, it's almost 2024, end of 2023, and what are the things that you've seen in the schools and in the students and families that are kind of the higher, more concerning issues that you've noticed?
I've been shocked at how increasingly common the active suicidal ideation is.
Yeah.
I have a lot of students who experience that frequently. I think that's been pretty shocking to see. Yeah. And it's been scary because, 1 year you're like, wow, I can't believe how many of these I've encountered. And then it's more the next year. So I think the increasing number of suicidal ideations.
This is in adolescence.
Adolescence.
Just young kids who have their whole future ahead of them.
Right. It's devastating.
Yeah.
And I know there's a variety of factors contributing to that. But I think that that's probably one of the most prevalent issues. And then because that's a prevalent issue, I think that we see more of the other things where students will turn to substances or completely disengage and practice complete school avoidance or whatever the case may be, because they're trying to cope with a society that they feel doesn't work for them.
Let's dig into that a little bit more. So you've seen this increase in suicidal ideation, and especially among adolescents. And what are some of the triggers, and what are some of the symptoms and signs that you've seen? I know there's a lot of variables, but what are the things that you've seen that are leading towards kids feeling that way?
I think that any indicator of depression is going to be a huge indicator of later suicidal ideation. This hopelessness, like a sense of almost apathy, like nothing matters. I think there's also a sense of what's my purpose? Like maybe the biggest aspect that I see is disconnection. Like they don't feel super connected to their peers, to their community, to their school, to their family. That can be a huge indicator as well.
Okay. And do you see any common patterns or themes of how somebody ends up feeling that way or thinking like that? Because what I've seen and what I've, through other speakers and through what we've seen in the program is it's not as simple as you think. It's not like,
Totally.
oh, this person is, you know, has abusive parents and this and that. It's not always, I mean, sometimes people are in good families.
Absolutely.
And they're good students. And I mean, sure, there's bad students and there's abusive families, but it's not this black and white. Hey, if you're like this, A, B, and C, 1 + 1 = 2. It's, I've had even people who are professionals who deal with suicidal ideation, and these are people who are experts and who have kids and who have great families. And if anyone is looking at them from the outside, right, they're like, oh, this person's happy, right?
Right.
And I think that's what we've even seen that in kind of Hollywood and in the singers and all these entertainers who everyone looking in, oh, this person must be happy, they have everything, and then they commit suicide.
Right.
Robin Williams, and the list goes on. But I think, to me, as somebody who's inside the industry and that sees what's going on in the news, but also kind of sees what goes on behind the scenes, I think that's the most shocking thing to see, that it's not as simple as a formula, right? Like if you do this,
it's really
right?
not.
But at the same time, there are patterns and there are situations and there are things that make things worse instead of make things better. And I guess what I wanted to explore with you is, first, what makes things worse? Because we want to avoid that.
Right.
And then after that, we'll talk about, well, what can we do to make things better? And that's definitely something that parents would love to hear.
Yeah. Okay, that being said, I'm glad you said that, because I do think it's not a one-size-fits-all situation at all. I do think there are a series of things that make things worse, and one of the main ones that I see commonly is a lack of emotional support at home. So maybe the parents are there physically and they're trying to be there to support their student, but there has to be space for all the emotions when they're sad, when they're mad, that emotional validation that a student needs. Also, a huge one is a community, like to feel connected to the people they're around. Anytime they're disconnected or in a new area, I see transitions being a huge point where students can sometimes start to decline because they feel extremely disconnected from the community and from their peers.
So that's if they're transferring schools or something of that nature?
Yeah, and sometimes it's not even that significant. Sometimes it's a move within the same school district. They're going to the same school. Any sort of transition is usually a time when a student's going to need additional support.
Okay.
I think we oftentimes overestimate an adolescent's ability to navigate transition, and it's traumatic for them a lot of the time. And that's something that's often overlooked. Something else that I see is students that have this comparison aspect, which I think is social media, siblings, society in general. I think that that's something that is a huge warning sign. And I think it's hard for parents because there has to be, you want to have that emotional support, and you also want to have those boundaries of like, I'm going to take your phone away after 9 p.m. because this is no longer good for you at that time. So I think that it's a touch and go kind of balance. That's not a one-size-fits-all situation, but I do think that there are a lot of things parents can do. And one of the best things that they can do is just to encourage their children to participate and be part of something. Right.
Yeah, no, I mean, just, my kids are younger. But, they're 7 and 9, the ones that go to school. I have a younger one too, but she's still at home. But, what I notice with them is, they're just so eager, right? They're so eager to share and talk about what happened at school, and they, sometimes they talk too much, but and they're all different too. I mean, one of them's more quiet, one of them talks more, but at the end of the day, they just want you to listen, and they just want to share that with you. And then sometimes they want their time to be on their iPad, and so it's that balance, right? And it's, having the screen time settings and, limiting it to whatever the number of hours per day, and trying to create balance. Because I think if you're too restrictive, at least this is my experience, but also I've seen it kind of supported with evidence, is that if you're too restrictive, then that's going to push them in the wrong direction.
Absolutely.
But if you're too lax and you just let everything go, that also pushes them in the wrong direction. So, that's where I think a lot of times, one of the things I've seen in our programs, and, we also have some other facilities with residential programs. Sometimes clients say, well, this is not fair. You treated this person this way, but you treated me this differently.
Yeah.
Obviously, going to my own household, my kids say the same thing. I think this unfairness or inconsistency is something that comes up. Now, the way I look at it, and I could be wrong, but I think I'm right, is that it's not always about fairness and it's not always about consistency, but it's about what makes sense. So maybe one thing works for somebody, and maybe I have to tell my son, hey, you have to do this, and my daughter has to do that. And, whether it's maybe extra reading for one of them or maybe extra time outdoors for the other one, it doesn't all have to be the same. And I think where I come in and I try to explain them is that, we're all different.
Yeah.
So something that won't work for one person doesn't work for the other person. If we treat everyone the same and if we tell everyone to do the same thing, we're not going to see the same results. So, different, and that's the whole case by case thing, right?
Absolutely.
So whether it's a client, a patient, you're doing counseling, you're just parenting at home, it's okay to do things differently for different
Absolutely.
kids. And I think that's one thing I see, like sometimes the rigidity in, well, this is our approach. Like, you have to do this. This is the way we're going to do it. And and then some people end up with one kid who's really successful and does really well, and the other one that becomes ostracized is because you didn't take the time to figure out a customizable approach.
Right.
And it's okay if it's different for the different kids.
And sometimes they didn't do what you did in your home, where you say, this doesn't have to be fair for it to be right. Of, okay, here's why it's different for this person. Versus, because that's a huge component of it, which I think you hit the nail right on the head of, okay, so this is going to be different for this student because what they need is different. Right. And without explaining that why, then you have more disengagement.
Right. Yeah, the why is so big. It's so huge. Yeah.
Yeah.
So, I think we were talking about earlier what kind of makes things worse, and you mentioned, it's whether it's spending too much time on social media because then they become consumed with it, and then it's all these false images of people in the one moment that they're happy and not all the other moments. And it's this idealization of everyone's rich or everyone's successful or everyone's traveling, and that's not the case, or it might be the opposite of that, where they're disengaged and they're just kind of reclusive and going into their own head, right? Because if the more time you spend in your head, it doesn't matter who you are. I mean, me and you, like, it doesn't matter who you are. Being in your head is not the right place to be. We got to be out there. We got to be active. We got to be working on our problems and not thinking about them. So now, having said that, what are some of the tips and tools? Because we would like to share tools and tips that can help families and can help people out there. What are some tips and some tools that you would like to share that you've seen work well? Yeah.
I think limiting screen time is a huge one.
Okay.
And when I say that, I want to make the caveat that this looks different for every student.
Right.
So some student needs more time to complete their homework and then to still have time to, have a moment to, be on their social media.
Sure.
I don't think that it should be prohibited for all students. So it's a matter of communicating with the child and figuring out, okay, this is where we can find balance and this is what works for this student. But limiting that is huge. It's going to improve sleep. It's going to improve their stress levels, their overall feeling of well-being. That being said, getting enough sleep is a huge component too.
Right.
If the student isn't able to get enough sleep, they're not going to be able to manage the stress or do well on the test or manage any of those other obstacles they face. And some of the things, they seem simple, but not overscheduling the student is huge for a lot of the families that I work with, because, and we're in Orange County, so a lot of these families are talking about college and where to go and what they expect. And because college admissions are so increasingly difficult, students carry increasing, loads of stress. So a lot of that conversation has to be around, okay, you can't take 5 AP classes and be the captain of the cheer team and, lead this club. Something has to give. And teaching students that well-rounded approach is going to make you a better applicant. It's not going to make you worse. It's going to make you better at the things you like and have time to do.
Makes you stand out.
Yeah. The overscheduling it's out of control.
That's been so overscheduling and just putting too much stress. We had on another episode, we had Dr. Bolton, who's the principal at Newport Harbor. And one thing he shared, and I kind of want to get your thoughts on it too, is, he shared that, sure, at all these schools, especially the schools in Orange County where the parents are really active and they want their kids to go to, Harvard and Stanford and UCLA and Berkeley and USC and, get that 4-year college degree and kind of go and maybe become professionals or doctors or whatever it is, right? But what he was saying is that they're also trying to work with families and the kids to say, hey, look, some people just want to go and work. Like they want to go to a career and maybe they go to JC or maybe they go straight into a trade school and a profession. There's different routes and different paths for different people. Yeah. And ultimately you look 5-10 years down the road, if somebody's doing what they're passionate about and they actually want to do, rather than wasting their time doing something that someone else is maybe forcing on them, they're going to ultimately see success. Absolutely. So it's great to get a 4-year degree. It's great to go to law school or become a doctor or whatever. But there's also people who are 18, they go and they figure out what they want to do, they learn that skill, and they end up becoming more successful than somebody with a PhD.
Absolutely.
So it's, if the goal is success and the goal is happiness and the goal is to have a life of productivity, there isn't one way to do that.
Absolutely.
So is that something that, as a counselor, you work with families and students to kind of open their eyes and see, hey, there's different paths?
That's a huge part of my job. Okay. And in our community, we have a huge gap for what they call the middle skills jobs. So things that maybe require trade school or some sort of associate's degree, but not a 4-year degree.
Got it.
We have a lot of those job openings in Orange County specifically that aren't filled because families encourage the 4-year degree and students think that that's the only path to success. Right. So a huge part of the work we do is educating families on their options, especially being in California. You can go to 2 years of community college for free. Right. So with the California Promise program, that makes it a great option for a lot of families.
And then you can kind of transition into whether you want to go to more school or you want to do this.
And a lot of those students are going to make more money than some students that get a bachelor's.
And that age range is really sometime where maybe that further exploration is necessary, right?
Absolutely. And what is more valuable than that, further exploring your interests?
And it's better to figure it out between 18 to 20 than kind of waste 10 years of your life and then have to figure it out in your 30s and 40s.
Absolutely.
Right, which we see all the time because people just followed a path and then they even achieved it and then they're like, oh, I'm not happy, so I have to start over, or I have to transition to a different career, right? We see that all the time. Okay, no, that's great. So, we talked a lot about mental health, and I think, a lot of those issues like depression and anxiety and kind of just, those types of issues that creep into it and then ultimately that suicidal ideation. We touched a little bit about substance abuse and addiction, but what do you see at that earlier adolescence? Because we see a lot of that with the young adults. Yeah. Right? But at the adolescent stage, what drugs or what are you seeing in the schools and even maybe not in the schools, but within the communities?
Right. Nicotine is the biggest one. Okay. The students, a lot of them have access to e-cigarettes and marijuana, specifically in the pen form. Okay. That's the most common that we see. But we also continuously hear about more and more adolescent overdoses because of fentanyl becoming so common in so many of the other drugs. And
it's just in anything. It could be in a pill. It could be in some other drug.
Absolutely.
And you don't know it because, they don't tell you.
Yeah. And that's a huge thing, is a big push at a lot of the local schools where they're saying schools need to have Narcan on hand because this is an issue that these students are encountering, accidental overdoses. Right.
Right, training the staff, having it on hand. Yeah. Being prepared for it. Yeah. And so you've definitely heard of that and you've seen it. Yeah. And is it mostly? Fentanyl is obviously the big one, right? Because that's something that that's a one and done, like, deadly situation. Right. And it's a lot of people who they don't even think that they're taking it. Right. A lot of people think, well, somebody is going out and getting that, but they don't even know it's in it. And it's such a lethal dose, even just a very minuscule amount, right? And so, fentanyl awareness is a huge thing now, right? Yeah. What do you guys do in the schools to raise awareness, both within the students and the families, about that?
Yeah, my favorite thing we've done is partner with a community organization called End Overdose.
Okay.
Have you heard of them? I'm not sure.
No, I have. Yeah.
A small organization right now, but growing. And they'll provide free Narcan training, as well as free Narcan. So they also come out and provide community education.
Okay.
So, I try to push that resource out as much as I can. I think the most important thing is just education.
Okay.
And making there be events where students are already engaged, and we're using that as an opportunity to be like, here are some issues we're encountering. Fentanyl is in a lot of drugs, because the issues of overdose with youth that I've personally encountered have mainly been accidental.
Right.
A lot of the students that are intentionally doing drugs are not intentionally doing fentanyl, at least in my experience.
Right. It's like you said, accidental.
Yeah.
And that's the scary part of it, right? It's because you could, I don't know. It's just one of those things. Both the suicidal, the act of suicide and the fentanyl. I mean, those are the two biggest areas that we see where things have changed a lot over the years. In the old days, somebody would go to treatment. Some, people had certain addictions, but they had the opportunity to try multiple times and hopefully get it right? Yeah. But now you see situations where somebody takes the wrong thing and it's over. Yeah. They don't get that second chance. So that whole staying away and figuring out the tools to deal with these issues of depression, anxiety, whatever's causing their, in their mind thinking, okay, I want to, whether to go to the substance or I want to do something to myself. Yeah. I think those tools are so important because you never know when you get that second chance.
Absolutely. And a lot of students, they think, I'm stressed, I'm going to do this and relax. Right. And not realizing how serious that really has become.
Right. And so have you seen the benefits of these events and the awareness and the education? Have you seen, because as you said, it is getting worse. Yeah. Right. We know that, but I think the awareness is also starting to improve, and I think we have a lot more work to do. Yeah. But have you seen any results from all this effort?
I think anecdotally, I haven't seen data behind it, but I've seen the students that I've talked to, have reports of, knowing this is helpful. Right. And, as sad as it is, I do think that it's important that the students know what to do if they do encounter that, because it's becoming increasingly prevalent. So while anecdotally I have heard that it's helpful to know, I also think that it has to be part of a preventative plan.
Right. I think Narcan was such a good example because we've had several situations where, we've given that out and found that saved somebody's life.
Absolutely.
Right. And so sometimes people make the wrong decision. Yeah. But if they have the tools or the resources close to them or to people close to them who can save them, then that's one life saved right there.
Absolutely.
And these are all things that you kind of put together, right? Education, awareness, treatment, therapy, counseling, Narcan, there's certain medications that help, in certain circumstances. So it's really this holistic effort that we talk about, and we have different people come to the show that have different backgrounds. Right. But it's really that holistic effort that it's just such a huge mountain to climb. Yeah. And I think that's where that hopelessness comes in. And I think that's where, to me, sports is a good example where, if you put one person and said, hey, you have to go do this, it might be very challenging for that one person. But if you put a team together and that team works cohesively and works together, then that becomes a milestone or something that's like reachable, right? Yeah. And so I think that's one thing I would advocate here is, it's not something that whether it's just the parents or just the kids or whoever it is can figure out themselves. It's a team effort, and it includes the school counselor, and it includes maybe private therapy, it includes maybe a outpatient program, residential program. It includes fitness, it includes a lot of different things. And I think if you do all of it and you're actively engaged in being mindful and working towards it, those are the clients and the patients that we've seen that have succeeded. Yeah. And it's whenever you give up or whenever you say, okay, well, I'm doing pretty good now, I'm not going to do this anymore, I'm not going to do this, that you start creeping back into old habits and whether it's a relapse or it's kind of going backwards, right? We want to avoid that. So I think what you do is so great.
Oh, thank you. Me too. I love it.
Yeah, no, it's just fascinating because you're in the battleground, right? You're right there, and you see it every day. And the fact that you're so passionate about it, and I mean, I can see it.
Yeah.
I think we need more people who are so passionate and who love what they're doing.
Right.
Because I think part of it is love, and part of it is that empathy. Like you said, you're an empathy enthusiast. I think that connection is the most important thing.
I do too.
And for people to feel connected, that's half of the battle right there, because then they can say, okay, well, at least there's a chance, at least there's hope. And then they can work on, okay, well, what do I need to do to get better?
Yeah. So valuable to have that understanding component.
Yeah. Well, I really don't have any more questions, but is there anything you want to share, any experience, personal or with your students, or anything where maybe you want to give an example of something, or any other topics you wanted to discuss today?
I think that we discussed everything I wanted to discuss. I would really like to just reinstate the fact that it's so possible to get help if that's something that you're willing and feeling ready to get. I think that so many students realize they could benefit from help but don't know the first step. And connecting with someone like a school counselor or any trusted adult is such a good first step for students to help get the support that they need.
Right. And I think one thing I would add to that is just for the parents and the families to know that there are resources out there, and there are people who are very passionate and who are willing to put in the effort and time to work with the family and the student, because a lot of the times you can't just fix the student, you have to work with the family, and it's a really team effort.
Absolutely.
And so I think the family needs to be as engaged and as willing to work on themselves and on the situation as the students do.
Yeah.
And I think if you have buy-in from all directions, then we can really make some good things happen there.
Definitely.
Yeah.
I think that's super valuable.
Well, I really enjoyed speaking with you today.
Yeah,
and
I enjoyed
thanks
it
for
as
coming
well.
on the show.
Thank you so much for having me. I'm glad to be able to do it.
That was great.
Thank you.